90% of the people who walk into my office with a cold made the exact same mistake. They waited. They thought it would go away on its own, or they ran to the pharmacy and loaded up on fever pills, nasal sprays, and cough syrups, and never did a single thing that actually stops the infection. I'm Sam Waterling, and after 15 years of watching this play out in real patients, I'm done staying quiet about it. What you're about to hear is the real mechanism, the physiology, the biochemistry, the clinical reasoning behind a step-by-step protocol that actually works. Because a doctor who explains the mechanism is a doctor you can actually trust. Subscribe to Dr. Waterling and hit like. We are pushing toward 1,000 subscribers, and every single one of you moves that needle. Here's the truth. Nobody at your next appointment is going to tell you. The healthcare system is not designed to prevent your illness. It is designed to manage it. There is no financial incentive in keeping you well. Nobody gets paid when you stop showing up sick. Subscribe if you want the other side of that story. Let's start at the very beginning. Let's talk about how your body actually defends itself against respiratory infections. And I mean the real mechanism, not the vague reassurance you get told to just rest and drink fluids. Respiratory, that word just means breathing related. Any cold, any flu, any rhinovirus, any adenovirus, they all enter the body the same way, through the nasopharynx and the upper airways. That is not a coincidence. That is the route viruses have used for millions of years of evolution. And it is precisely there that your body has built its first and most critical line of defense. The entire inner surface of your nose, your nasopharynx, your trachea, and your bronchi is lined with something called the mucous membrane. Mucous membrane, that is tissue that continuously produces mucus. And before you make a face, most people think mucus is a sign of disease. That is wrong. Healthy mucus is protection. It is a biological trap for viruses. When viral particles enter your nose, they settle into that layer of mucus the same way dust sticks to tape. As long as that virus is sitting in the mucus and the mucus is moving normally, it never gets a chance to attach to the actual cells of the mucous membrane, never penetrates inside a cell, never starts replicating. You do not get sick. That process has a name, mucociliary clearance. It means self-cleaning of the airways. Tiny hair-like structures called cilia line the surface of the mucous membrane and move in coordinated waves, constantly sweeping mucus and everything trapped in it outward and upward. This is happening inside you right now as you watch this. The moment that mechanism breaks down, the virus gets its chance. Research published in Cell Press shows this clearly and unambiguously. It is the speed and the strength of the immune response in the nasal mucosa, not the virus itself, not the viral load, that determines whether a person gets sick or not. Think about what that means. Two people are exposed to the same virus in the same room. One gets sick, one doesn't. The difference is not the virus. The difference is what happens in the mucous membrane in the first few hours. When mucosal cells detect a virus, they release interferons. Interferons are proteins. Think of them as the body's internal alarm signal. They block viral replication and instruct neighboring cells to raise their defenses. If interferons respond fast, the virus is stopped cold. If the mucosal environment is compromised, if the mucus is too thick and not draining, if the cells are dehydrated or stressed or inflamed from a prior irritant, the virus establishes itself and starts multiplying before the interferons even get mobilized. That window between viral contact and interferon response is the entire game. This is why the first hours matter more than anything else in this equation. Not day 3, when you already have a fever of 101, your throat is burning, and you feel like you were hit by a truck. The first hours, right after you notice that first scratch in your throat, that first hint of congestion, that subtle loss of smell, or that low-level heaviness and fatigue that doesn't quite feel like tiredness, that is the signal. Your body is telling you it's starting, and you have a window, a real biological time time-limited window to stop it before it becomes a full illness. The simplest, most accessible, and physiologically sound method to stop an infection at the starting line is alkaline steam inhalation. Let me explain the mechanism. Ordinary baking soda, that is sodium bicarbonate, when dissolved in water and heated, creates an alkaline environment in the steam. Alkaline means a pH above 7. For reference, pure water is pH 7, and most respiratory viruses replicate most efficiently in a mildly acidic environment, pH around 6 to 6.5. Alkaline steam entering the mucous membrane directly disrupts that optimal replication environment. At the same time, warm, moist steam thins out thick, viscous mucus, making it fluid enough for the cilia to move again. And simultaneously, it reduces the inflammatory swelling of the mucous membrane itself. 3 separate therapeutic actions, 1 pot of water and 1 TBSP of baking soda. Here's exactly how you do it, step by step, so there is no ambiguity. Take 1 TBSP of ordinary baking soda from your kitchen, put it in a medium-sized pot, add 1 L of water, that is approximately 4 cups. Place it on the stove and bring it to a full boil. Once it is boiling, reduce the heat to the lowest possible simmer. You want the solution to stay gently steaming, not boiling aggressively. Sit down at the stove or move the pot to a table. Lean over the pot at a distance of 8 to 12 in from the surface, close enough to feel the steam on your face, far enough that it is not scalding you. Drape a large towel over your head and the pot to create an enclosure, a steam tent, and breathe that steam calmly, naturally, without forcing deep breaths. Just normal, relaxed inhalations through your nose for 10 to 15 minutes. Do this in the morning after waking up and again in the evening before bed. Keep this up for a minimum of 2 days in a row. Ideally 3. What is physically happening inside you during those 10 to 15 minutes? Warm alkaline steam travels through your entire respiratory tract, from the very front of your nasal passages, through the nasopharynx, down the trachea, all the way into the small bronchi. It coats the entire mucous membrane along that path. It liquefies mucus that has become too thick to move, restoring the fluid layer the cilia need to function. Mucosal cells that are properly hydrated and in an alkaline environment recover their antiviral signaling capacity significantly faster than dry, acidic, or inflamed cells. And the temperature of the steam causes vasodilation in the mucosal blood vessels. That word just means the vessels widen. Wider vessels mean more blood flow. More blood flow means more immune cells arriving at the exact site of viral contact. Every component of this is working together to create conditions where the virus simply cannot establish a colony. Alongside the inhalation, I strongly recommend also instilling a baking soda solution directly into your nose. The concentration for nasal instillation is gentler than the inhalation solution. You are putting this directly on the mucosa, not just breathing steam. The ratio, just under a 1/4 teaspoon of baking soda dissolved in 1 cup of warm water, 250 millimers. Stir it thoroughly until no granules remain. Let it cool to warm, comfortably warm, not hot. Now lie down flat on your back. Using a small dropper or a 1 milliliter syringe, instill 1 milliliter into each nostril. 1 milliliter is roughly 20 to 25 drops. Stay lying down for 1 to 2 minutes. This allows the solution to distribute across the nasopharynx. Then stand up. Within seconds, you will feel the nasal passages begin to move. Mucus will start flowing. Breathing will open up. What you are experiencing is the alkaline solution, reducing the swelling of the nasal mucosa, reopening the drainage pathways, and mechanically flushing the viral particles that were sitting in that mucus right out of your body. That same solution works for gargling. Take a mouthful, gargle for 30 to 40 seconds with your head tilted back so the solution reaches the back of the throat, then spit it out. The mechanism is simple and purely physical. You are washing viral particles off the mucous membrane of the mouth and throat before they have had enough time to attach to epithelial cells, the surface cells of the mucous membrane. This is not a pharmaceutical treatment. This is mechanical elimination of a biological threat. It costs essentially nothing. There are no side effects. And it works precisely because it targets the virus before it has entered any cell, before the battle inside the tissue even begins. Now let's talk about what happens when you miss that window. You didn't act in the first hours. A day passed, maybe two. The infection moved deeper. A cough developed, first dry and irritating, then progressively wetter. That shift from dry to wet cough is a clinically meaningful signal. It means the inflammation has traveled down to the bronchi. Bronchitis is inflammation of the bronchial mucosa, the same type of mucous membrane lining we talked about, but now it is in the bronchi. The bronchi are the branching tubes that carry air from the trachea down into the lungs. When their mucosa becomes inflamed, it swells and begins overproducing mucus. That excess mucus accumulates in the bronchial passages and partially obstructs airflow. This is what produces the characteristic wheeze and chest tightness some people feel. Your body coughs reflexively to try to expel that mucus, but the cough is often insufficient on its own. The mucus is thick and viscous and adheres to the bronchial walls rather than moving freely toward the trachea. This is precisely where bronchial drainage becomes critical. Drainage, the word literally means promoting the outflow of accumulated fluid. Bronchial drainage is a specific set of physical maneuvers that use vibration and rapid pressure changes within the chest cavity to mechanically dislodge mucus from bronchial walls and mobilize it toward the larger airways where it can be coughed out. This is not something I invented. Vibrational chest physiotherapy is a recognized technique in pulmonology and respiratory physical therapy used clinically in patients with bronchitis, pneumonia, chronic obstructive pulmonary disease, and bronchial asthma. The difference here is that you can do a simplified but effective version of it yourself at home with no equipment. Here is the technique precisely described. Stand up straight with enough room around you. Raise both arms up and slightly out to the sides. Not straight up like you're surrendering, but diagonally outward. This specific position opens and expands the chest wall, stretches the intercostal spaces, the spaces between your ribs, and maximizes lung volume. Take the deepest, slowest inhale you can manage through your nose. Fill your lungs fully. Feel the rib cage expand in all directions, front and back and sides. Hold that expansion for just 1 second at the top. Then, and this is the key moment, exhale sharply and forcefully. Not a slow exhale, a sudden, strong, pushed exhale. In the exact moment that exhale begins, strike both sides of your lower rib cage simultaneously. And I mean simultaneously with your forearms. Your forearm is the segment of the arm running from the elbow to the wrist. Use the bony, slightly fleshy part of the inner forearm, not your fists. A fist concentrates force too narrowly, not your open palms. They dissipate the vibration. The forearm delivers a broad, firm vibrational strike. The vibration transmits through the rib cage directly into the lung tissue and bronchial walls, and it physically dislodges mucus that is stuck there. The forced exhale simultaneously creates a rapid pressure drop in the bronchi that helps pull the mucus loose. Gravity and the cough reflex that follows complete the job. Perform this exercise 4, 5, or 6 times per day, multiple separate sessions, 3 to 5 full repetitions per session. You will notice results within a few hours. The cough becomes productive, meaning you are actually expelling mucus rather than just having a dry spasm. That productive cough is not a sign the condition is worsening. It is a sign the drainage is working. While mucus is actively moving out of the bronchi, inflammatory spread is limited. The moment mucus stagnates, sits motionless in warm bronchial passages, it becomes an ideal growth medium for bacteria. The bacteria colonize that warm, nutrient-rich pool and begin to multiply. That is the pathophysiological sequence by which bacterial pneumonia develops after a viral respiratory infection. Pneumonia, which is inflammation of the actual lung tissue rather than just the bronchial walls, almost never appears without warning. It is almost always preceded by a period of bronchitis with stagnant mucus. Clear your bronchi consistently, and you remove the conditions that allow pneumonia to take hold. Here's the next clinical scenario, one I see week after week in my practice. A patient comes in and says their cold is mostly gone. The runny nose cleared up, but the head feels heavy and full. There is a dull pressure, sometimes sharp pain around the nose, the cheekbones, the area behind the eyes or above the eyebrows. There is a congestion that simply will not clear, no matter how much they blow their nose. Occasionally there is a low-grade temperature, 99.5, 99.8 degrees Fahrenheit. Sometimes there is a bad taste in the back of the throat or post-nasal drip, a sensation of mucus running down the back of the throat. This clinical picture is not a simple cold anymore. This is sinusitis, inflammation within the sinus cavities. The sinuses are air-filled hollow spaces inside the bones of your skull. We have several pairs of them. The maxillary sinuses sit to the sides of the nose beneath the cheekbones. These are the ones most commonly involved in what people call a sinus infection. The frontal sinuses sit above the eyebrows inside the forehead bone. The ethmoid sinuses are a honeycomb of small cavities deep within the nose between the eyes. Each type of sinusitis takes its name from the sinus-affected maxillary sinusitis, frontal sinusitis, ethmoid sinusitis, but the mechanism driving all of them is identical. Here's that mechanism in plain terms. Each sinus connects to the nasal cavity through a small opening, a natural drainage port. Under normal conditions, the mucus that the sinus lining produces drains continuously through this port into the nasal cavity and gets swept out. It is a self-cleaning system. When you develop a viral upper respiratory infection, the mucosa of the nasal cavity becomes inflamed and swells. That swelling physically closes off or significantly narrows the sinus drainage ports. Drainage stops, the sinus fills. Bacteria that are normally present at low levels in the nasal cavity migrate into this warm, stagnant, oxygen-depleted pool and begin proliferating. This produces purulent, meaning pus-containing sinus inflammation. The entire cascade starts from one event, blocked drainage, and the entire treatment logic flows from one goal: restore that drainage. Drainage is restored with the same baking soda nasal installation described above, just under a quarter teaspoon in 1 cup of warm water. Lie on your back, 1 milliliters in each nostril, 2 minutes lying still. Stand up, blow your nose gently, not with maximal force, because forceful blowing can actually drive infected mucus further into the sinus or into the middle ear. Repeat this twice daily. The alkaline solution reduces mucosal swelling around the sinus drainage ports. Those ports reopen, the contents of the sinus begin to flow outward and downward. The copious discharge you experience minutes after installation is the sinus draining. That is exactly what you want to be happening. Once drainage has been reestablished, and you will know because you can feel the nose clearing and mucus moving, then you move to the next step, warming the affected sinuses. Take a clean cotton sock. Fill it with coarse rock salt or any dry grain that retains heat well. Buckwheat, rice, or millet all work perfectly. Tie off the opening. Heat the sock in a dry frying pan over medium heat, turning it occasionally until it reaches a temperature that feels clearly warm to hot in your hand. Comfortably holdable, but with real therapeutic heat. Place it against the maxillary sinuses on both sides of the nose below the cheekbones, or against the frontal sinuses above the eyebrows, depending on where your symptoms are located. Hold it there for 20 to 25 minutes. Local heat dilates blood vessels in the overlying tissue, drives increased blood flow to the sinus region, accelerates the resolution of inflammatory processes, and draws more immune cells to the site of active infection. And now the rule I cannot stress enough. You apply heat only after drainage has been restored. If you apply heat to a sinus that is still blocked, where there is no outflow, you are doing the precise opposite of what you intend. You are creating a warm, sealed, nutrient-rich bacterial incubator. The heat accelerates bacterial proliferation. The infection gets significantly worse. This is not a theoretical concern. This is the clinical mechanism behind the conversion of mild, self-limiting sinusitis into severe or complicated sinusitis. I have seen this pattern repeatedly. Someone starts warming their face on day 1 of sinus symptoms without first opening the drainage. And by day 4, they are in my office with a much more serious infection. The sequence is everything. Drainage first, warming second. That order is not interchangeable. Now let's cover tonsillitis, what most people describe as an extremely bad sore throat. The medical term is acute tonsillitis. Acute meaning sudden in onset. The tonsils are 2 oval-shaped masses of lymphoid tissue positioned at the back of your throat, 1 on each side. Lymphoid tissue is immune active tissue. It is literally made of immune cells whose job is to survey everything passing through the throat and mount an immediate defense against anything pathogenic. The tonsils are the forward observation post of your immune system for the oral and nasal routes. In acute tonsillitis, that post is overwhelmed, most commonly by a bacterium called Streptococcus pyogenes, known clinically as Group A strep. The tonsils become swollen and red. A white or yellowish pus-covered coating appears on their surface. Swallowing becomes painful or even difficult. And temperature can rise to 101 or 102 degree F. Left untreated or treated ineffectively, streptococcal tonsillitis can lead to serious complications, including rheumatic fever, which is a systemic inflammatory condition affecting the heart and joints. This is why tonsillitis deserves to be taken seriously. The treatment strategy I use runs in 3 clear steps. Step 1, reduce the swelling in the tonsillar tissue and restore normal blood flow through it. We use the baking soda solution again, this time for frequent gargling, every 2 to 3 hours throughout the day. A full mouthful, gargle for a full 30 seconds with your head tilted back, then spit. The alkaline environment is directly hostile to Streptococcus. The organism cannot thrive and replicate efficiently at elevated pH. Simultaneously, the mechanical action of gargling physically removes pus, bacterial colonies, and dead immune cells from the tonsillar surface, clearing the battlefield and reducing the total bacterial load the immune system has to fight. And the solution reduces local swelling, which helps restore circulation through the compressed tonsillar tissue. Step 2, actively increase blood flow to the tonsils. The immune cells your body deploys, lymphocytes, neutrophils, macrophages, they travel in the bloodstream. More blood arriving at the inflamed tonsils means more immune firepower arriving at the exact site of infection. You drive that blood flow with 2 sources of heat. External, wrap your neck in a thick wool scarf. Wool specifically, it is an excellent insulator and holds heat longer than synthetic materials. The sustained warmth dilates the blood vessels of the neck and throat region. Internal, drink hot tea in small, deliberate sips, not gulping down a full mug at once, but small sips every 15 to 20 minutes throughout the day. Each small sip of hot liquid passes slowly over the tonsillar tissue, delivering warmth directly from the inside. That direct internal warming of the tonsillar mucosa is meaningfully more effective than simply warming the outside of the neck. To that tea, you can add honey, which has well-documented mild antibacterial and soothing properties on inflamed mucosal surfaces. You can also add conifer resin, the natural sap from pine, spruce, cedar, or fir trees. Conifer resin contains phytoncides, volatile organic compounds produced by coniferous plants that have clearly demonstrated antibacterial activity against a range of pathogens, including respiratory bacteria. They work directly in the respiratory tract, reducing the concentration of airborne and surface-level pathogens in the immediate environment of the mucosa. This is not traditional folk belief that I'm endorsing uncritically. Phytoncides from coniferous plants have been studied sufficiently to understand their mechanism. A small piece of solid resin or a few drops of pine resin tincture added to hot tea produces a drink that is genuinely therapeutic, not just comforting. Step 3, topical antiseptic application. An antiseptic is a chemical agent that kills or inhibits the growth of microorganisms on the surface of living tissue. I recommend miramystin for this purpose. Miramystin is a modern antiseptic with broad spectrum activity, meaning it works against a wide range of bacteria, viruses, and fungi. It has a solid body of clinical research supporting its efficacy, specifically including activity against Streptococcus. Crucially, it does not induce antibiotic resistance, a major practical advantage over some older antiseptic agents, and it is non-toxic to the mucous membrane at therapeutic concentrations. Use it as directed on the packaging 3 to 4 times per day as a gargle or spray. While your systemic immune response fights the infection from within the tonsillar tissue, miramystin reduces the bacterial burden on the surface. You are fighting from both sides simultaneously. Now, the question I get asked more than almost any other in 15 years of clinical practice: why do some people get sick 3 or 4 times every winter, while others go years without catching anything significant? The answer is not genetic luck. It is not some mysterious constitutional immunity you were either born with or weren't. The answer is the functional state of your immune system at any given moment, and that state is determined by 3 factors that are completely within your control. Your immune system operates on 2 levels. The first is local or cellular immunity, the immune cells that live directly within the mucous membrane tissue itself. Neutrophils, macrophages, T lymphocytes, B lymphocytes, these are your first responders. When they are functioning well, a virus is identified and neutralized on contact, and you experience no symptoms at all. The infection is aborted before it ever clinically manifests. The second level is systemic or humoral immunity, the immune cells and antibodies circulating throughout the bloodstream. These are your reinforcements, the reserve army that arrives when local defense has been overwhelmed or insufficient. The visible signs of that systemic response showing up: a red, swollen throat, fever, body aches, are literally the physical manifestation of your bloodstream flooding the infected site with immune resources. What degrades that first level of defense? Your local mucosal immunity. 3 main factors that I see underlying most recurrent respiratory infections in my patients. The first is chronic stress, not acute stress, not the adrenaline you feel before a difficult conversation or a tight deadline. Chronic, sustained, unrelenting stress. When you experience ongoing stress, the adrenal glands, 2 small glands sitting atop your kidneys, continuously release cortisol. Cortisol in short bursts is a normal and essential hormone of physiological adaptation. But when cortisol levels remain chronically elevated, it exerts a direct suppressive effect on the immune system. This is well understood biochemistry. Cortisol inhibits the production of interferons, those same early warning proteins we discussed at the start, and it reduces both the number and the functional activity of T lymphocytes in the mucous membranes. A person living